Helping you live healthy. Studies show more than 30,000 men will die from prostate cancer this year. September is Prostate Cancer Awareness Month. Doctors say it's more common in older men and African-American men. Joining me now is Mayo Clinic Cancer Center oncologist Dr. Trevanne Matthews Hew. And Dr. Hew, you are part of a new program aimed at helping detect prostate cancer in minority communities. Some people might not realize that Black men have a higher risk. Tell me a little bit about the steps you guys are taking to make people aware of this.
Yes, absolutely. Thank you, Brianna. So Mayo Clinic is involved in a new consortium. It's called iCare. And what it stands for is Inclusive Cancer Care Research Equity for Black Men Consortium. So it's a consortium. It's funded by the Department of Defense, and with Dr. Faleke Adedina as a principal investigator. The consortium is a partnership between 5 different institutions, 4 in the United States, 1 in Nigeria. It's called Covenant University, as well as a national prostate cancer advocacy organizations. So the iCare Consortium is focused on achieving healthcare equity by reducing disparities associated with prostate cancer diagnosis, treatment, survivorship, while improving patient cancer outcome reported outcomes. It's important to think about prostate cancer. It's one of the most common cancers in the world, actually, as well as United States. But there are certain groups that are more at risk, men of an older age and African-American men. African-American men have a higher incidence of developing prostate cancer, and they're twice as likely to die from prostate cancer.
And we know guidelines vary, but what is your advice as far as when men should be screened for prostate cancer?
Thank you. So, the screening guidelines have changed throughout the years. Actually, there's controversy back and forth, but now the guidelines states it's something that should be discussed with your healthcare provider. So men of age 55 to 69 should speak to their healthcare provider about their risk factors, about what the risks and benefits are for prostate cancer screening. But, however, for African-American men, there is a change in that guidelines where less than 55, you can speak to your healthcare provider again and discuss your risks, as well as, what would be the benefit of screening with you. Now, there are other things to consider, whether or not you have a family history of prostate cancer. Do you have a family history where someone was diagnosed earlier who died from prostate cancer, and other types of cancers that may have a genetic link, such as aggressive breast cancer, ovarian cancer, pancreatic cancer. Those patients are at higher risk and therefore should be screened earlier. So right now the guidelines are to discuss with your healthcare provider what the benefits would be for screening.
And what's your message to men who are a bit reluctant about, going to the doctor or taking screenings like this out of fear of a scary result?
Understand. And, and it's not just the men, as well as, the women in their lives and the family should also encourage them. The prostate cancer screening is a blood test, which is a PSA. It's done. We can go over the results. We can also do another type of screening, which is a digital rectal exam. If there is a prostate cancer diagnosis, then we can talk about what's next. It's the knowing, because there are different types of outcomes that can occur. You can have a high grade or high risk prostate cancer that is found, and that would need more intervention than one that could be monitored. And again, it's individualized. It's based on your age. What is your life expectancy? What do you want to do about this diagnosis or not? So again, back down to individualization. If you come in to see us, we're not going to force anything on you. It's a discussion that we're going to have.
Absolutely. Well, thank you so much, Dr. Hew with the Mayo Clinic Cancer Center. We really appreciate having you on this morning.
Absolutely. Anytime. Thank you so much.